Good morning, and thank you for joining me for today's edition of People in Perspective. I'm Christine Rickey, and joining us this morning is Dr. Rachel Levine. She's the Secretary of Health for Pennsylvania. Thank you for joining us.
Well, good morning. Thank you for inviting me.
Here we are in a time that I would say none of us have ever experienced with coronavirus, a word that came out in 2020, COVID-19. And a lot of things have been done through the state to try to curb the rate of infection among our residents. And the latest thing is the COVID app. Can you tell me a little bit about how the COVID app works for people?
Sure. So this is a really new and innovative solution to some of the issues we have with contact tracing. So the way the app works is you're able to download it for free on Apple products or Android products. So it's an Apple and Google product. It was developed by Nearform, and it will connect with other phones through Bluetooth. So there's no monitoring of GPS or anything like that in terms of your location. And if you happen to be exposed to someone that tests positive for COVID-19 that is also using the app, then you will be notified that you have had a close contact with someone, and it'll be anonymous, with COVID-19, and then you can either follow the directions on the app, or you can call the Pennsylvania Department of Health, and you would need to quarantine. So it's a significant advance in our battle against this virus.
Well, and I think it's very interesting. So I ate at a restaurant last night with a friend of mine in Hershey, and I can put that I was okay yesterday, but along the line, somebody might have been at the same restaurant, so they tested in the same time period, and I would get an alert. Basically.
That is correct. You would get an alert if you were within 6 feet for 15 minutes or more. And so that is why it is a really important advance, because people who test positive might not always know who their close contacts were. They won't know who was in the restaurant. And again, if you were in a public place like that, then you won't know who those people are. And so this is a way for us to notify people if they've been exposed so they can quarantine. And it's another way that we can be united together to stop the spread of COVID-19.
And to reiterate, it's all anonymous. And when you get tested, you get a code number to put into the app so people don't know who you are.
That is correct. This technology is completely anonymous. And again, it does not track your GPS, so we're not monitoring where you've been or anything like that. It is using the same technology that connects you to your headphones or to your car.
Now, say there's people that are still kind of like, I think the COVID-19 pandemic is done with, and what would you say to that?
Well, unfortunately, they're not correct. The COVID-19 pandemic is not completed in any way. There are significant increases in the amount of COVID-19 in many states in the United States and in other places of the world. It's particularly increasing in the Midwest, North Dakota, South Dakota, Nebraska, Wyoming, Iowa, etc. And we are still having, hundreds and hundreds of new cases per day in Pennsylvania, and we're monitoring a number of outbreaks in counties. So COVID-19 is still here, and it's still something that we have to be united about in terms of stopping the spread.
And with the flu season coming up, is that more of a concern with the COVID too?
It is. We always have a flu season. This is our annual flu season. It starts pretty much in October and then continues to the spring. We see increasing rates in October, November, December. It peaks in January, February, and then slowly goes down in the spring. We see thousands and thousands of people who get the flu, many who have to be hospitalized. And so we're worried about having the annual flu outbreak that we always have while we're also dealing with COVID-19, which highlights how important it is for everyone, and even more this year, to get a flu shot, because we can protect you against the flu.
Is there a better time than another to get the flu shot? Like, should I get it now? Should I wait to mid-November, December?
You should get it now. The flu vaccine is becoming available now throughout Pennsylvania, and now would be a great time. You can go to your medical provider, but you can also go to almost any pharmacy and even many pharmacies and grocery stores and get the flu vaccine. The flu vaccine is safe and effective and is a great way to protect you from the flu. And that is one way to help you during this very challenging season.
And in general, you always have the steps of just trying to protect yourself. What are the steps that we still should be doing no matter what?
Well, it is so important that we practice those steps that I have talked about sometimes almost every day. It is very important for people to wear masks. It has been shown over and over again in studies in the United States and throughout the world that a simple cloth mask or some of the other disposable masks that you can buy can protect other people if you might have COVID-19, and can help in protecting you as well. In addition, we need people to wash their hands and to use hand sanitizer. And people need to social distance and avoid large gatherings. And that's a great way to protect yourself from getting COVID-19 and stopping the spread.
And specifically masks, because this is an irritant of mine. I see people wearing the mask like this, just under their nose, like you're not
Yeah,
wearing
the
the
mask
mask
has
right.
to cover your nose and mouth because that's where the virus would come from. And so having a mask that's down by your chin is not effective. So it has to be a mask that covers your nose and mouth. And you should really wear it pretty much when you leave your door. If you're going to be in public, then you should wear a mask, whether you're indoors or outdoors. If you're going to be in public, you should wear a mask, and that protects other people, and it protects you too.
Do you have any concerns of people that might say that they have health concerns and can't wear a mask? Should they then opt for the face shield or?
Well, so there are people who have some health problems where they can't wear a mask. A face shield is another option, although the face shield is probably not as effective as the mask. So there are people, for instance, who might have chronic obstructive pulmonary disease. That includes emphysema or chronic bronchitis or something like that, or perhaps congestive heart failure, that can't wear a mask. Of course, children under 2 shouldn't wear a mask. And anybody who can't take the mask off themselves that would have a problem with that, then they might not be able to wear a mask. But for the vast majority of the population can wear a mask, including children, and that is a very safe way of protecting yourself, your family, and your community.
Especially with the winter months coming up where you're going to be spending more time even indoors, this allows you to continue to go out. Obviously, we don't want to do a quarantine where we're all stuck inside again.
So that's exactly right. And so, as the seasons progress and it becomes colder, as you said, we do spend more time indoors. These type of respiratory viruses, whether it's COVID-19 or the flu, spread more easily indoors. And so that is one of the reasons why we tend to see more of these respiratory viruses in the winter, and why we're worried about the flu, and we're worried about potential significant increases in COVID-19.
Do you have any thoughts on when a vaccine for COVID-19 might start to become available for people?
Well, we don't know exactly when the vaccine will be available. The United States has Operation Warp Speed, where they're working to develop 6 vaccines all at the same time. That's not how it usually goes, but they've investing tremendous amount of resources in that development. The vaccines are undergoing what are called clinical trials, where they have many thousands and thousands of people who get the vaccine. And we want to make sure that it is proven to be safe and effective. And at that time, when scientifically through the FDA and Health and Human Services, it has been determined to be safe and effective, then we expect one of the vaccines to be released, and then hopefully actually a number of vaccines will be released. We are working right now on all of those plans to distribute the vaccine and to administer the vaccines. It's not the vaccine that's the issue, it's vaccinations that's the issue. We have to make sure that people get the vaccine. In addition, a number of the vaccines will probably have 2 doses, so we have to make sure that people get the booster dose at the right time. So we need to make sure the right vaccine goes to the right person at the right time, and we are working on that, as other states are right now.
That's terrific. And again, the main purpose of this interview was to talk about where you are with this new COVID Alert PA app, which I think is ingenious, and it is anonymous if people are concerned with that. Any other thoughts on the app of what maybe people can find? Do they check in daily or?
Sure. Well, we have approximately 160,000 downloads of the app, which is great. And the more people that download it, the more effective the app is, because that's what we're looking for. We're looking for thousands and thousands of people to have the app, and that helps its effectiveness. That helps it work better. And we want to tell people this is completely voluntary, and it's completely anonymous. and we're not tracking everybody. And it's a great way that you can protect your health, your family's health, and your community's health as we all work together, united in Pennsylvania to stop the spread of COVID-19.
Terrific. And the app also is working to connect people in other states too. It's connected already with New York and New Jersey. Am I right?
It's connected with Delaware, and New York and New Jersey will come live over the next couple of weeks. And so, yes, Delaware, New York, and New Jersey will all be connected to the same type of app, and they'll all work. It'll all work together.
But it is not tracking you. It's not using GPS. You just got to make sure to have that Bluetooth
GPS.
on.
No, we want to make sure that people understand. We don't know. We don't want to know where you are, and we don't. No one else knows where you are. It's just working by Bluetooth, and it memorizes that Bluetooth signature. And so when if you have been exposed, it'll tell you, and then you can quarantine to protect the public health.
Any last minute thoughts for us, Dr. Levine, that you think our audience might be interested in learning about?
Well, I just wanted to emphasize that what COVID-19 has certainly taught us is that we're all in this together. We are all interconnected. And so we want to work together. We want to be united, and we all want to stop the spread of COVID-19. And in that way, we can protect ourselves, our families, our communities, and Pennsylvania.
Terrific. Thank you so much for your time this morning.
Dr. Rachel Levine, Pennsylvania's Secretary of Health.
Thank you.
And now joining us to talk about immunizations and why they're so important is Dr. LJ Tan, the Chief Strategy Officer with Immunization Action Coalition. Good morning, Dr. Tan.
Oh, thank you so very much for having me, Christine. Appreciate the opportunity to talk about immunization.
Can you start off by telling us first why immunizations are so important for people of all ages?
Yeah, so absolutely. I think one of the things that has happened, obviously, because of COVID-19 disease, we have fallen behind in our wonderful immunization coverage rates. Pre-COVID, we were doing really well with kids and with teens, but not well with adults. Well, after COVID, now our coverage rates have just totally plummeted. And of course, what we know is when you don't have routine immunization coverage in the country, we're going to start having outbreaks of disease that we used to be protected against. And so that's why they're so important. And with COVID-19 disease still looming over us this fall and into spring, hopefully we'll have a vaccine then. But until then, and beyond, we need to make sure that all our population, teens, adults, infants, children, are all protected against these diseases so that they don't end up getting sick themselves, as well as transmitting the disease to others as well.
And in general, while I think you touched upon it, a lot of these diseases came about, before my lifetime, likely your lifetime. So especially the people that are younger than you and I, they might be saying, what is the big deal? If I miss a month, 2 months, 5 months, a year. So tell us, Dr. Tan, what is the big deal that could happen? Like if, polio or the measles came back?
Obviously, one of the things why routine immunizations are so important is because of the fact that when we have dropping coverages that you just highlighted, what happens then is that we've got these opportunities for these diseases to get a foothold and get back into the community. So immunizations does not only protect the person who gets vaccinated, it also develops within the community something that I like to call community immunity because it rhymes and it sounds really cool. But other people call it herd immunity, of course. And this is the idea that, when we have enough people vaccinated in a community, the disease can't get that foothold, right? And if they can't get that foothold, people who are vulnerable, people who can't get immunized because of cancer, because of immunological disease, so on and so forth, they are protected because everyone else, their community, is protected. So that's the reason why we need these rates back up where they were before COVID. And that's why we're out here trying to get people, to go back and get vaccinated as soon as possible.
And I found an interesting study from the CDC saying 50,000 adults die from vaccine preventable diseases each year. I'm assuming the flu, since a lot of people might opt out of getting the flu shot, some because they actually fear the flu shot could actually kill them. But you'd say that's not the case, right?
Yeah, that is absolutely correct. I mean, this fall in particular, flu is so important, as well as some of the other diseases that we worry about, like pneumonia, for example. But flu this fall, because with COVID-19 disease likely to return, the last thing we want is what I call the twindemic, where we have both flu on top of COVID-19. Firstly, those populations that are vulnerable overlap, right? You're talking about the elderly, you're talking about people with heart disease. They're the folks that are going to really suffer if they get both influenza as well as COVID-19. So we need to get rid of flu by getting these folks vaccinated. And then more importantly, if we do have this resurgence of COVID-19, we don't want people going into ERs and into the hospital systems, with flu on top, and surging the system. We talked all spring about surge capacity. If we have flu on top of COVID-19, talk about surge capacity issues, right?
Exactly. As long as we're staying on top of it and trying to remain healthy, the key takeaway here is that immunizations do work, right, Dr. Tan?
Absolutely. If I can leave your audience with any message, is that we've got vaccines against many vaccine preventable diseases. They are nasty. You don't want to catch them.
So children need them, adults need them. Even if you're pregnant, you need them. You just have to stay on top of what the doctor recommends, correct?
Exactly. And that healthcare provider, that physician, or whoever your healthcare provider is, they can help you decide, assess, make sure you get the right vaccines and catch you up, because a lot of people have not got vaccinated yet.
Anything else you'd like to add for me today?
Yeah, if anyone has any questions, you can always visit our website at immunize.org, or the Women in Government, who we're partnering with on this messaging, at their website too.
Thank you again for joining us this morning, Dr. Tan. Dr. LJ Tan, the Chief Strategy Officer with the Immunization Action Coalition. And I'm Christine Rickey with your People and Perspectives.